ahead and start tonight's segment. So tonight is all about minority health, and we're going to have a focus on racism and reform. So as we look at the state of minority health, we want to have conversations around, what does the state of minority health look like, and how should we be approaching minority health and treatments in terms of how we provide different services and different things to the community as it relates to overall health. And with racism being acknowledged as a public health emergency, what does that mean for the state of minority health? And in all, what types of policies could we explore or look at to help change the state of minority health within the United States? So as we begin to look at that, I want to kind of set the stage so that everyone understands, exactly what minority health is. So before we look at minority health, let's take a look at what health is in general. So when you think about health, health is a state of, complete physical, mental, and social well-being. And it is a state that has absence of disease. So when you think about being healthy, you're disease-free, and all your different senses or categories of health are being fulfilled and sufficient. But in a lot of areas within the United States, especially in minority communities, the state of health looks a little bit different depending on who you are, what your race is, your age, and a number of different environmental factors like your address and the part of towns that you live in. So when you look at minority health, it's important to look at the disease-free life expectancy, or how long you're going to be able to live without disease, because it have important implications in terms of your quality of life and reducing overall health diseases and healthcare costs that's associated with those diseases. So as we mentioned, our focus tonight is on minority health. And what we have in terms of minority health, especially in the United States, when you look at different categories of people, when you look at white people and Black people and Asian people, Hispanic people, there are disparities that are being seen across that spectrum. And even when you're looking at race, there's things like your socioeconomic status and your age and your location and your gender that all plays a factor on your health. And all of these things matter because as our population becomes more increasingly diverse, it's projected that people of color would, account for half of the population. And if those people of color are suffering from different types of diseases, it diminishes the quality of life of those people and the types of things that we could be able to provide to them to improve their health. So as we look at the current state of minority health, there's different factors going on. If we're looking at, the diseases that are associated with different categories of minorities, we got to look at things like, the COVID. There's high incidence and prevalences of COVID being diagnosed in minority neighborhoods. And even with that, the vaccine, trying to get people treated, trying to get people vaccinated, there's different discrepancies between different race and age categories in terms of whether or not they're going to take the vaccine. In addition, you got to look at things like the leading causes of death, especially when you look at, minorities, especially African Americans, things like heart disease, cancer, stroke. All of these things are high causes of death for African Americans. And not only that, when you look at infant births, African Americans also have high incidence of where there are infant deaths within the Black Americans. So when you look at all of these different types of things, there's chronic health conditions, there's environmental conditions, there's health coverage conditions, there's all kinds of different conditions that are different, especially depending on the type of person and your race and your environmental factors. But as we look into the future, things that we can look at in our environment that we have in our favor and things that we need to know to move on, I'm sure a lot of our panelists are going to talk about these things tonight. But as we look forward to things that we could, move forward to in the future in terms of policy, we have to look at health coverage and how we can extend more health coverage to minority communities. There's high percentages of uninsured people within our minority communities compared to white people. So we have to look at policies that help African Americans get more access, and minorities in general get more access of health insurance. In addition, we have to look at policies that help improve and prevent chronic health conditions. Like I mentioned, minorities suffer from chronic diseases more than white Americans. So we have to look at policies that we can put in place that can help prevent some of these diseases. And last but not least, focusing on how we can decrease different leading causes of death that's experienced by minority communities, and especially in these areas, how can we look at strategies?
Yeah.
Minority communities.
Yeah.
That's kind of where we're at in terms of the state of minority health and things that we have in our environment and what we need to know to move forward. Looks like Tim has joined us, but I think we're going to be going to commercial soon. So we'll take a quick commercial break and then we'll get back to our conversation with our panelists.
Hey, thanks a lot, Raheem. Can you hear me now, Raheem?
Indeed.
Can you hear me?
Indeed.
You can? Okay. All right. So we're going to take a short break and then we're going to let our panelists join us for this much needed conversation. And let's go ahead and bring our panelists on the screen.